If you're over 50 and asking yourself, what makes a penis strong? You're asking a smart question. And no, we're not talking about size or bragging rights. We're talking about real function, strength, firmness, blood flow, and performance. Let's break it down clearly and simply. Hey, I'm Dr. Zoe Hartley, and on this channel we speak honestly about men's health, especially after 50. Today's topic: understanding what actually gives you strength down there. Because the truth might surprise you, and it's more fixable than you think. 1. Healthy blood flow equals stronger erections. Your penis is a vascular organ. It relies on good circulation. If your arteries are clogged, or your blood pressure's off, you might notice weaker firmness. What helps? Regular cardio exercise, walking, cycling, lowering cholesterol, avoiding smoking, managing blood pressure and diabetes. 2. Strong pelvic floor muscles. Yes, men have them too. These are the muscles beneath your bladder and testicles. Strong pelvic floor equals stronger, longer-lasting erections, and better control during sex or urination. Try Kegel exercises. Squeeze the muscles you'd use to stop urine. Hold for 5 seconds, then relax. Do 10 reps 3x/day. 3. Testosterone levels matter. Testosterone fuels libido, energy, and muscle tone, including sexual function. After age 30, levels drop slowly each year. Check yours if you notice low desire, fatigue, weaker erections. Talk to your doctor, don't guess. TRT, testosterone therapy, is only for some men. 4. Nerve health equals sensation plus control. Your nervous system sends signals that cause arousal and climax. Nerve damage from diabetes, surgery, or spinal issues can reduce control or sensitivity. Protect your nerves by managing blood sugar, avoiding alcohol abuse, getting regular movement. Sitting all day weakens signals. 5. Mental and emotional health. Your brain is your biggest sex organ. Anxiety, depression, porn addiction, or relationship stress can kill performance. Strength means feeling safe, being emotionally connected, managing stress, not ignoring it. It's normal for things to shift after 50, but it's not the end. Most men can still have strong, satisfying sex lives well into their 70s or 80s, with a few smart changes. It's not about power. It's about function, health, and connection. Think of it like keeping a classic car running. You don't need to race it. Just keep it well tuned. So what makes a penis strong? Healthy blood flow, strong pelvic muscles, balanced hormones, and a clear mind. You're not broken. You might just need a tune-up. Like this video if it gave you clarity. Subscribe for more honest, respectful talk about men's health. Next up, watch how do healthy penis look. Because that might be affecting your strength more than you realize.